Good day. I am Hazel Simendihar, and now I'm going to talk about the postpartum personal hygiene. So, what is personal hygiene? And what is the importance of this in the postpartum care of a mother? So, personal hygiene is a concept that is commonly used in medical and public health practice. It is also widely practiced at the individual level at home. It involves maintaining the cleanliness of our body and clothes. Can be described as the principle of cleanliness and grooming of the external body. Failure to keep up the standard of hygiene can have many complications, not only as there increased risk of getting an infection or illness, but there are many social and psychological aspects that can be affected. Postnatal hygiene. The postnatal period is a very vulnerable time for the mother since she is prone to various infections. It is also a time when she requires a lot of physical and emotional support from her family, especially from her partner. Neglecting to provide hygienic care for the mother during this time will only increase the chance of infections in both the mother and the child. Postnatal hygiene is very essential as this can prevent infections and speed up the healing process of the mother's body to return to the pre-pregnancy state. Postnatal hygiene is applicable not only for the mother but also for the people around her who are caring for her and the child. So postnatal hygiene is a very important that should the mother is doing this, as this will help them to prevent from getting complications or acquiring infections. So there are effective postnatal hygiene tips that I'm going to talk about that is helpful for the recovery of the mother. The first is washing hands. It is the most important because it can help to prevent cross-contaminations between the mother and the baby. Washing hands is an effective way of ensuring postnatal hygiene is to wash your hands with lather and rinse under running water. Wash your hands before you eat, after washing the infant's clothes, and after trip to the toilet. And also, before you hold your baby, you should wash your hands to avoid infections or cross-contamination. The next one is the toilet hygiene. Frequent urination after childbirth leads infections if not cleaned properly promptly. A way to ensure postnatal hygiene is to clean the genital area with warm water from front to back and pat dry. Stay hydrated. During the postnatal period, there is an urge to urinate frequently as the body gets rid of the extra water accumulated during pregnancy. A postnatal hygiene tip to prevent or reduce bladder infection is to drink lots of water. Drinking water is very important because it helps us to stay hydrated. Since you lost a lot of water in your body, so you should drink a lot of water to keep you hydrated and to prevent you from having a bladder infections. Maintain breast hygiene. It is essential to maintain the hygiene of your breast as any infection may also spread to the baby. Rinsing your breast in water after breastfeeding is a postnatal hygiene tip you can follow. And also, warming your breast with with water in the towel is very important, as also it stimulates the milk producing. And you should rinse your breast before your baby latching your nipple, as this will help to maintain safeness of the baby. The next one is the perineal care. It is also important that we should have a perineal care to avoid infections. The tear and stitches in the perineum will take some time to heal. During this period, you must take utmost care to maintain postnatal hygiene by washing this area twice or more with water, perhaps with some dilute antiseptic. And also, warm water could be helpful to ease the pain of the perineal. The next one is the postnatal bleeding care. After childbirth, you will have some heavy bleeding like a menstrual flow, which might last up to 2 weeks. Ensure postnatal care by cleaning the intimate areas and changing the sanitary pads 2 or 3 times a day, as this will help to make you safe. And also, you should change sanitary pads to avoid an foul odor of the vaginal discharge. And also to avoid complication. After a cesarean, if you experience a cesarean delivery, extra care must be taken to ensure postnatal hygiene. Remember to keep the stitches and navel area clean. Take care not to put pressure on the stitches while holding the baby or feeding. Next one is rest and exercise. It is normal to feel exhausted after childbirth. Among the postnatal care advice for new mothers, the most essential is rest. Make sure to get enough sleep, and also do some postnatal exercise are advised by your doctor or your physician, as this will help you to make your body return to pre-pregnancy state, and also it will help you to rest. Food hygiene. Food hygiene. You must also make sure to eat hygienic food, because as this, you lose a lot of energy during the childbirth. So you should eat hygienic food, which is like fruits and vegetables. Before eating those, you should wash all the fruits and vegetables properly and ensure the food is cooked fully before eating, as this will help prevent from getting diseases or infections. Visitors hygiene. Another postnatal hygiene that must be followed in the visitors hygiene. Both the mother and the baby can pick up infections from visiting friends and family, and it is advisable to limit their number to prevent you or your baby from getting any infections. So also, this would be an important matter that we need to remember. It's because your friends could be a carrier of some diseases or virus. So you should limit the person who will touch your baby. It was because it will help this to baby from getting away from acquiring infections. Because if your baby get an infections, at the end, you will the one who will suffer and not them. So to all mother out there, we should acquire and promote personal hygiene during the during the childbirth, because it will help us to create and make a healthy living. And this will help to ensure the safetyness of your baby and your care. Thank you for listening, everyone.